Get your tape ready at all times. Make sure you are ready to go so you don't have to scramble. So you got one big fat one, and you rip this one about halfway. Then you're going to rip another piece so you in half, so you got two little quarters.
The PowerPoint helps too.
And you want to make tabs at the end?
Nope,
Not yet.
I'll show you. You're going to crack your catheter open. Remember, you're going to check it, make sure there's no burrs. I like to loosen it up a little bit. And I'll take this end off and place it right there, getting it ready to go. Make sure my bevel is up. Okay. I'm going to hold on to my patient. I'm going to check to see if I got any flashback. When I see a flashback, I'm going to take my index finger and I'm going to push it off the stylet or the needle. Okay. There's blood coming back, so I need that. Oops. I'm going to take this out. There. It's all ready to go. Now, see how I'm holding that? Now I can move this around. You never want to tip this up this way because you're going to kink your catheter, or this way, or just let it flop around because it may just get pulled out. So you want to keep your finger and your thumb there and holding onto your patient's leg. What you do is just tip this up a little bit, lay it down, bring the tape over, and every time you bring it over, you squeeze that. You can make a tab at this point if you want. Okay, make a little tab. There you go. Then you're going to take your notch tape and you're going to bring it up and place on either side of the catheter hub. Never ever go over this joint here because you may have to, you're going to attach your fluid line there and you may have to get to it for some reason or another, and if you got this all taped over, it's very difficult to get. So you're going to bring this up and over behind it. Again, pinch it. If you want to make a little tab, that's fine. Now at this point, I'm going to attach my fluid line. So what I like to do is I usually hold it this way, put my line in. Now a lot of times I'll put a piece of gauze underneath to catch any blood. Then you take your second piece, your skinny piece, and you're going to go over right in the middle of this hub, because this is where you want to do your injections. So you don't want to tape over that. Normally this leg is kind of short. We would go farther up on the leg because you want to be above where the dog, well, we're a little above it, where the dog or the cat bends its foot. This last piece, of course, is for the fluid line. And what I like to do is make a little loop like that, because if you just tape it on, it's going to slide around. So I put it right next to the leg, bring it up and over. Of course, you want to do it too tight. There you go. Make your, now you have an IV catheter placed.